Oh, so thanks for meeting with me this morning, Lelanie. Um,
Problem. Thanks for the invite.
oh, so we connected on LinkedIn, didn't we? Because we both do things to try and sort of share stories about how
That's right.
how people become psychologists, what their work as
Yes.
psychologists involves. Um, and I haven't quite figured out whether these stories make more sense whether when we start with what are you doing at the moment, or whether we start at the beginning. I've done different things in different
Okay.
interviews.
Okay.
Where do you want to start? Do you want to start at
Oh
your
gosh.
beginning, or do you want to start where you're at
Um,
now and then tell us how you
um,
got there?
let's work backwards. At the moment, I'm working in the NHS,
Mm-hmm.
but I'm soon to leave the NHS. Actually, after years and years of being in the NHS, I work as a consultant psychologist in Wales, in Powys, and
Mm-hmm.
we support people who have long-term health conditions. And that's
Right.
sort of the area that I've landed up working in. Here in Powys, we support people with persistent pain, long COVID, and other fatiguing conditions like CFS-ME, and also
Yeah.
weight management. We are a level 3 weight management pathway, which means we support people before they will consider bariatric surgery, perhaps at level 4.
Yeah.
Um, but really, my story is all about physical health and psychology together. If I jump back to where it started, it'll
Mm-hmm.
make sense. I went to Wolverhampton University to study counseling psychology on a doctorate.
Mm-hmm.
My first placement was meant to be older adults. And lo and behold, the placement fell through, and the university scrambled to find me another placement. And it landed up, I worked in persistent pain. I'd never heard of it. I wasn't aware that psychologists worked with people who had physical health issues. And then I never left. I loved it so much. The next part of my placement then changed to stroke and cardiac care, and I had opportunity to work in renal with chronic fatigue syndrome. We had groups, neuro, a little bit of neuro. Um, just thinking, was there anything else? And it was a lovely setting in Dudley in the West Midlands. There were a ton of psychologists all working with long term health needs. And it was so fabulous to be in a team where everybody were passionate about the same thing. And then I also was very interested in mental health. I did a long placement, a year and a half in secondary care, mental health. But when
Mm-hmm.
jobs came up, it landed up in physical health, and I've sort of climbed the greasy pole in physical health. But it's a fascinating field, you know. I think it's not well known enough, but it's so important for psychologists to be part of the story, part of the team that supports someone and supports their family. Because
Yeah.
oftentimes these long-term conditions are, if I use an act metaphor, we talk of this uninvited guest, this thing that happened to you. You want to get rid of it, you want to push it out the door, you want to throw it out the window, but you can't. And our job is often to help people live the best life they can, despite this unwelcome guest.
Yes. And I'm just trying to think, just trying to make sure. I mean, I love that. I love the way you've described that. So trying to think about how we best show people what that work might look like. So somebody's got this uninvited guest who, let's say, that's a long
I
term
think
pain
the
project.
Wi-Fi may have cut out on us a little bit there, Jen. So I'm just going to give it a moment.
Okay,
Okay, I can hear you. I hope you can hear and see me okay.
I can. Your image is frozen, but I can hear you. Okay.
Okay. It's just sometimes a little bump, isn't it? And then it will come back.
Yes, yes, I'm sure it will. And I'm thinking, let's just plow on where we've got the audio.
Okay.
Um, so somebody would come and see you with this uninvited guest. I love that metaphor.
Mm-hmm.
And let's say that's long term pain or that's chronic fatigue.
Mm-hmm.
And then what would your work typically look like? How would you help someone?
Um, there's so many different themes, but one of the themes that we focus on is adaptation to change.
Hmm.
Um, how a person can see their old self before they were unwell, to this new self that they perhaps never wanted or envisioned,
Yeah.
and thinking about who they are. What is there also of them other than this illness? Because the illness is very sneaky. Pain can take up every space it finds. The same with cardiac issues. If someone had a heart attack, they might feel so worried of living life to the full because they've realized they are vulnerable.
Yeah.
And our job can be about finding ways to help them feel more resilient, but also to deal with the grief and the loss. Because
Yeah.
sometimes there's a big part of them that they said goodbye to. Maybe there's a part that before a stroke, someone was very outgoing and active, and after a stroke, they might find being outside is overwhelming. The noise, it tires them out, and they may want to stay at home. So our job as psychologists is to have conversations, to find out what matters to people, and maybe it looks a little bit different, maybe it feels a little bit different, but also that person is still here. That person has got worth as a person. And there's so much more than what their illness or their health condition determines.
Yes. Oh, that's such a nice way of thinking about it. What are the most exciting, or like what are the moments about it that you love? Like you say, you've worked in this
Oh
field for such a
gosh.
long time.
Um,
What are your absolute best bits?
Best bits. I'd say best and worst sometimes are close. One of the trickiest moments I'll start with is when I went the first time in the hospital to work with a stroke patient. And I use the word patient because it was an inpatient setting. And I didn't really know very much. And oh my gosh, my heart just dropped because it's like, oh, what do I do? And that feeling of I felt completely as if I had no skills. I wanted a toolbox. You know, as psychologists, we like having tools and we feel prepared.
Mhm.
And I realized in that moment, I'm showing up. That's what's most important, not the tools or the tools I think I should have. And it turned into becoming a strength because it made me realize that sometimes we might think we need all these extras and we don't. If I can connect with a person, sit with them, really listen, that's what matters. And it was my insecurity about needing a tool or a strategy. And I mean, of course, they come in handy, absolutely. But that person to person connection, nothing gets the better of it. And even if it's momentary, if a person has a fatiguing condition, you have a very short contact, there can still be quality in it.
Yeah.
And that's the focus. It's always reminding me that what I plan to do is not important. It's what the person plans to do. And it's a great reminder because I think sometimes we can have this idea of I'm going to walk this path with you and we're going to do X, Y, and Z. It doesn't work like that, you know. And for us to be able to recognize and support people's autonomy, that's the focus, not about me. And I think
Yeah.
that's what I love about physical health. Yes, it can be scary. It can make you think, oh my goodness, people have such illnesses and such difficulties that they come across, and that can make you worried. But equally, people live. They find new pathways. They find new parts of themselves they didn't know they had, and they teach
Yeah.
us a lot. So I'm forever thankful, you know, meeting people. I mean, sometimes it's challenging. Sometimes it's the psychologist is not the person they want to see. That's okay, you know. But I also love the working with other colleagues.
Mhm.
In MDT or multidisciplinary team, we have physiotherapists, occupational therapists, speech and language therapists, nurses, doctors, dietitians, and learning to speak a language that makes sense to everybody is vital. And it reminds me time and time again how psychology can be a silo if we're not careful. That the things that I assume make sense do not make sense. They make sense if everybody were trained in the same way. and we're not. We all have
Mm-hmm.
skills, we all have bits that we can contribute, and they're important. But again, it reminds me, just listen, just take a moment. Yes, psychology is part of the formulation or the case plan, but there's things that our dietetics colleagues pick up that we would never think about. A physiotherapist can come to a way of helping someone feel less scared in their body. They can do movement, build confidence. OTs can be magical with helping people to think of fatigue management and maybe setting baselines, and thinking with people how to tackle their worries about flare-ups. And it's
Yeah.
that collaborative working, those opportunities, that teaches me the most. And in a hospital or in a community, you have to know the matron, you have to know the healthcare assistants, the nurses, because they see everything,
Yeah.
and you've got to put time aside to learn about them, learn about the ward, learn about the unit, because it's like a different world that exists in a hospital. And these are the people that can teach you so much. Again, they see the patients in the morning, they see them in the evening, they see them recuperating or perhaps struggling. And we might go and visit a patient for an hour, and we haven't got that full picture. So there's something about being open to conversations that are linked to the work that you're doing. And then that helps build the fuller picture.
Yeah. So you're working with inpatients as well as outpatients?
At the moment, it's a community service,
Right.
but in my history, I've worked in Dudley. There's a hospital called Russell's Hall Hospital, and that's where I worked on a stroke unit and a post-coronary care unit, and also renal unit. And it's similarly in Essex, where I worked in a stroke team. We would see people in that transition when they finished their time in hospital. They would then work with I've got to think the term. It's a team that works with people once they discharge to help them almost that transition going home. And that would be
Okay.
physio, speech and language, OT,
Yeah.
nursing. And then we would also offer home visits. And
Yeah.
it's just working across the pathway also sometimes helps you to see the components that you might not think about.
Yeah.
Early support to discharge. There we go. You can see I've not worked in that team for a little
Yes.
while.
Yeah.
Sorry. But it's something that you've got to be able to change gears almost. I find if you're in the community, you might sit with someone in a session. That's one sort of energy, one vibe. But to sit with someone in their hospital bed is very different. You've got curtains around you, but they're not soundproof. There's
Mm-hmm.
another patient lying on either side, and you're having this conversation. And again, you might speak to someone while they're in their physiotherapy session to help them get the most of that session, or work with a speech and language therapist. And it's just a good reminder. We need that connectedness. We need to work as teams. And we need to ask, can you tell me how to do this? Can you teach me? Because psychologists, we know a fair bit, but we don't know everything. And
Yeah.
that's really, really vital. The people that have taught me so much are in all of these teams.
Yeah. And so sometimes you'd be doing sessions with somebody one-to-one. Sometimes
Mm-hmm.
you'd be working jointly with another member of the
Mm-hmm.
team.
Mm-hmm.
Have you delivered any sort of like structured like group programs?
Yeah,
Yeah.
yeah, yeah.
Yeah.
In Dudley, we had a structured chronic fatigue syndrome group. If I remember correctly, I think it may have been it was a long one. I want to say 10 or 12 sessions. And also, it's for people living with chronic fatigue and their carers. I think there's something about whatever group you deliver, it's got to help the person, but also the people around them.
Mm.
And if I think of pain management programs that I've helped deliver, it's the same. There are components for the person, and then for their family to help them.
Yeah.
I've done loads of groups, but it really boils down to the idea of skills, psychoeducation, so people can understand and maybe not feel so alone, not feel, oh
Yeah.
my gosh, this is happening just to me. And then oftentimes I might use ACT, acceptance and commitment therapy, in groups, because it's all about people's goals, what matters to them, and then tying that with where they want to move next. What do they want to do? Even if it's the smallest little step, what direction do they want to go in? And I also think, in a group, in a pain management program, people have a cup of coffee halfway through. They put each other right. They've got all the wisest words, no psychology textbook, and that's the thing. You realize, yeah, okay, I'm doing a group, but I'm not the expert here. And
Yeah.
that's fabulous. People have so much knowledge. They live with their concerns 24/7. They know, they understand it. And that's the best moment. You hear them over a cup of tea and biscuit. They say that thing that lands so well. And that's fabulous.
I remember that about delivering groups in the NHS, that nobody wanted to come to a group. They'd often need a bit of persuading to come to the group.
Yeah.
And then you'd ask them at the end of the group, what was the most helpful thing? Oh, it was being in the group. It was meeting other people. And sometimes
Yeah.
they would hold each other accountable. They would
do.
challenge each other in a way
They
that
do.
you'd think, there's no way I could say that. You'd
Yeah.
be furious with me if I said that, but
Yeah.
they'd hear it from each other. And like you say,
So
it's
true.
those connections were
Yeah.
incredible.
I've
And you wished you could have shown that to people beforehand, those that were
Yeah,
reluctant to
absolutely.
come to the group.
Yeah, and you understand, it's some people, when they hear of a psychologist, they think we're going to do something to them, like hypnotize them or do something, or we might tell them that their condition is all in their mind. And all those myths have so much power that it
Yeah.
makes people stay away and struggle by themselves. But as you say, they come to the group, they meet kindred spirits, they realize that there is opportunity, there is change possible.
Yeah.
And then it's about getting them to leave after the last session. And sometimes we get people to write a little message to the next group. And that's cool. That's so lovely, because then they can say, you know what, I thought this was going to be a whole load of X, Y, and Z, but what I've taken away is A, B, and C. And that's lovely.
That's a great idea. I definitely would be stealing that if I worked in my previous jobs. And I love how all of this came about because of a placement falling through.
I know. I really didn't know about physical health psychology, and it reminded me that psychology is seen still very much as mental health. Absolutely, we work with people and their mental health, but we work with all people. So whether it's children, whether it's older adults, whether it is people in secure settings, wherever. And it was I found a good home. I love biology. I love understanding biology. But I will say the one bit of physical health psychology or clinical health psychology to be mindful of is that you learn so many terminologies and so many names and labels. And I remember initially I felt, oh my gosh, now I've got to go and swat up not only psychology, but also medicine. I've got to go and understand this type of back pain or this type of virus or whatnot. And you don't. There is absolutely something about understanding the basics, and that comes with experience and time. But it's that part of us that wants to feel secure and confident and not be an imposter, that part is very loud. And it says, oh, you've got to go and figure everything out. And you can chase your own tail. And you don't need that. You've got a doctor, a physiotherapist, an OT, speech and language therapist. These people are experts. And you can connect the dots. That's your job. Connect, tell a story together. But also watch out for that imposter syndrome, or else it's that feeling of I must know, I must understand. And that's taken me a while to understand and step back. Sometimes she shows up and she's like, ooh, but it's okay. Now I know I can have a conversation with her and say, hello, what are you doing? Step back, but it's yeah, just to be mindful. I remember my first placement in pain. I suddenly saw everywhere where I looked people who lived with pain. And it's that there's a saying, isn't there? If you buy a red car, then suddenly you notice everybody else who drives a red car. It's the same thing. And it's just mindful of something is novel and new and you will pick it up. But it's not to say that that's for you to sort out. It's not to say you've got the responsibility. Your role is in there, but it's much more nuanced than that.
I think there's something very powerful as well in people telling us their story. That I think sometimes as they're talking through the experiences they've had, then we're noticing and we're reflecting things back to them that I think help them to make sense of that journey. Also, I had a first session last week with somebody who's living with some long-term health conditions. And what we were also reflecting on as this person was asking me, what do you know about this condition? And I was saying, I think I've got a fairly basic understanding of it. So please don't assume anything, start from the beginning rather than talk to me as if I'm an expert on it. Because also what I'm aware of is that everybody that would have this condition would experience it slightly differently. And I think it would be harder, it would be worse for the therapeutic relationship building if I'm coming to it thinking, well, I know what this condition involves. I know what your life is like.
Very true.
Because of this other person I've worked with that had the same condition.
So true.
Then, I think we don't know our blind spots then, do we? I think, like you were saying, it's you said this at the very beginning, it's listening, it's connecting.
You reminded me of also the culture and how that impacts on working with physical health concerns. Some people that I've worked with have grown up at a time where they have an expert in a white coat. And this person would give them a diagnosis and they would follow their directions to a T. And some people then would come to us and want us to be that expert, want you to step into it, because they've learned that they are the patient and you are the expert, or the doctor is the expert. And what you just said made me think about that, how in the room our job is to work as equals, or not ever as the expert that's up here and the person is down here. And to notice when they invite us to do that, also think, where does that come from? Have they been a recipient of healthcare rather than someone who has agency in the healthcare that they receive? And it's sometimes also our ego. We've got to take our ego out of it, because it's lovely if someone wants to treat you as an expert. But what's happening, like you said, what's happening in that therapeutic relationship? Is this about you, or is it about the person? And that's something to take supervision. If the session starts being about you and how you feel, no, you've got to work it back. You've got to think, oh, what am I doing here? So thank you. Yes, that's a great reminder.
Yes. And you said that you're leaving the NHS soon.
Yes.
What's next?
What's next? Gosh. I did a bit of private practice work in the West Midlands years ago before the lockdown. And I'm going back. Yeah. So I'm going to work a little bit for a private company, private insurance company. And then I'm going to go back to offering physical health support in private practice. And I've noticed there are gaps in provision. The NHS does a fabulous job, my goodness. But it's also sometimes limited in what it can do. And there's many processes and procedures. And I'm really fascinated by thinking about how people can perhaps receive some NHS help, and then maybe I could support them at a different part of their journey. And really, again, those themes of making sense of what they're going through. Think about the learning about them, about their condition and its impact, but also thinking, how could we empower people? How could we sit with grief and loss and change? And also trauma. Sometimes the conditions bring with themselves a traumatic experience or being diagnosed as traumatic. So all of those components is what I hope to work with. And also in my work in the NHS, specifically people who live in larger bodies, we've noticed that people often present with a lot of different conditions at the same time. So they may live in a larger body, but they also have mental health needs, and they also are neurodivergent often. And that's really made me very curious about understanding ADHD, for example. And I've trained to be able to offer these assessments to diagnose ADHD because I recognize how someone's focus on understanding living with obesity and how they then deal with that can be impacted by their neurodivergence.
Yes.
And if we don't connect those dots, then the strategies we suggest to people might not work so well.
Yeah.
So I'm
Yeah.
hoping to put puzzle pieces together, if that makes sense.
Yeah. I did some wonderful training a couple of years ago
Oh,
about disordered eating and
okay.
neurodivergence.
Well, you'll have to let me know
I
what you
was,
did.
yeah, I remember that it was a dietitian and I think
Okay.
a psychologist or perhaps
Yeah, yeah, yeah.
CBT therapist. They were a double act. One of them was called Bernie Wright.
I'm going to
Um,
write that down.
it
See?
was a wonderful day's training. And not specific to ADHD, but also looking at, of course, how autism can affect
Yes.
can
Yes.
affect eating.
Yeah.
Um,
Yeah.
yeah,
It's for example, this a theme that came up a lot is how people might, from a food perspective, we talk about people who have sensitivities around texture or taste or smell. But then also from neurodivergence, people can have foods that feel safe to have, that are predictable, that will be the same as they
yeah,
had last time or the time before. And from an eating disorders perspective, we talk about ARVID, which is where
yes,
people have difficulties with texture and from a food and from a mental health perspective. And it's often only recognized in children, less so in adults. But when we think of neurodivergence, we also come across similar things that people feel changing what they eat and how they eat and what they drink and when they drink. That's part of all the components of them. You know, it's not just a food related behavior, it means something to them in psychology, it means
yes,
something to them in their neurodivergence.
yeah,
And I think we've got to be so mindful. There's so many labels out there, but for me, I hope I can understand better, you know, and then
yes,
pick things a little bit more accurately. And then when we talk about how to live the best life despite living with a condition, then maybe we can zone in on effective strategies.
yes. Talking about labels, I'm just thinking some people watching this won't know what ARFID means, and my
Oh gosh,
brain's
now
just
you're
gone
asking me.
blank.
Oh,
I kind of have that understanding of it. So it's about avoidance, isn't it,
it
of
is, yeah,
certain kinds of food.
that's right. Yeah, it's spelled ARFID. ARFID is, yes, it is avoidance, but it's also um, thinking about texture and taste, feeling safe with very bland foods, for example, feeling that to introduce a new taste or a new texture can be frightening, it can be revolting. There can be revulsion, there can be a sense of it's, oh no, I couldn't possibly do that. And sadly, what can happen is that a person with ARVID can eat foods that are not necessarily from all the food groups, and they
Mm,
might miss out on some vital nutrients. But the way in which food is introduced to them or palatable to them is perhaps very narrow, whereas people who don't have these limitations won't even think about it. And
Yeah.
that's the thing also about, if someone doesn't have all the nutrients they need, we've got to consider how can they make very good decisions. Perhaps is their fatigue worsened by it? Are they
Mm,
struggling to focus? Do they have gut issues as a result, or do they have gut issues already? And maybe the limited food can be to work around those gut issues. You know, it's all
yeah.
the systems in the body work together, don't they? So
Yes.
apologies, I cannot think what ARVID stands for. I think it's avoidance, restriction, food, intake disorder. Did I get that right?
Well done.
Thank you. It's a bit early, but yeah, it's. I'm careful because the labels, once they are there, you can't take them away.
Yeah.
And
Yeah.
certainly in meeting with people, we're very careful. We would say that something suggests it
Mm,
looks like ARVID or it looks like binge eating disorder. And we would do assessments and conversations and then talk to the experts, the eating disorders team, put them together with the person.
yeah.
But really, everything is all the systems. I wish there was a simple answer, but people are complicated, and that's beautiful. But it's our job to know that there's lots of puzzle pieces. It's not just
Yeah.
one thing we give a label to, and that sorts everything out.
Yeah. You're really making me reflect on that, the complexity. And I know from when I worked in physical health that we would
Mm-hmm.
talk about biopsychosocial models
Yeah.
of health and well-being.
Mm-hmm.
And I guess that's part of the difference, isn't it, of what you're working with, perhaps compared to somebody working a different service. You've got
Mm-hmm.
that, you need to have that, and we're saying it, obviously you're not having to have the biological understanding in the same way as a doctor would, but
Mm-hmm.
you need to know what's going on for somebody in terms of their physical
Mm-hmm.
health.
Mm-hmm.
And then you've got that neurodivergent lens for some people. You've got that understanding of their mental health. What is it that they're struggling with? What is it that they're wanting to work on? What's going on in their social world? What are their relationships like? Are they able to work? Again, I'm also thinking, zooming. I often think about when I'm working with people, sometimes we're zooming into something and we may be looking at some strategies for a really specific part of what they're dealing with. And
Mm-hmm.
sometimes we're zoomed right out and we're
Yes.
looking at bigger kind of existential meaning of life type of
Yeah.
questions.
Yeah.
But here I feel like I'm zooming out and I'm thinking about the cost of living crisis, and I'm thinking about
Yeah.
benefits, and I'm thinking about
Yeah.
the financial struggles that so many of your patients will be experiencing. And again, I'm calling them
Yeah.
patients because we're talking about a
Of
medical
course.
setting.
And it's no surprise, sadly, that many people who live in areas of deprivation, people who perhaps don't have all the services and facilities that are supposed to be available to them, it's no surprise, but it's a sad, sad surprise to know that people have often presented with mental health difficulties and also presenting with mental health issues that become long-standing because there's not always a service provision.
Mhm.
And certainly for us, when we think about that wide lens, there are areas in where I live in Wales, there are areas where there are areas of deprivation, and people oftentimes have physical concerns and mental health concerns linked to living in an area of depravity. And it's not taking away anything from people who work extremely hard, who are extremely committed people, but sometimes the situation they find themselves in is not supporting
Yeah.
or supporting sufficiently. And you're so right. We've got to, I think as psychologists, we have got a role to play in planning. And what I mean with planning is services, planning pathways, working with colleagues who are perhaps in politics, working with colleagues who are in, I don't know, all the components about social development and understanding how people make sense of where they live, what they need to live a good life, and having those conversations, because it's vital if we want to support people in the NHS or outside. Sometimes we see a concern downstream. And by
Yes.
the time we meet that concern, it's been there for 10 years, 20 years. Whereas if we can work on the cause or the causes upstream, then perhaps we prevent people from living with difficulties.
Yeah.
And we also make sure that a thriving community can contribute to the community, you know. But it sounds very simplistic, but it's not. But I've got a big passion for thinking upstream. What can we do? How can we create policies? How can we work with the local government officials and be part of the conversation? So,
Yeah.
yes, we do clinical work, but we also have to do strategic work. And that's strategic for locally where we are, but also nationally and across the 4 nations. We have got a lens that you so beautifully put, and we've got to use that lens. And I think it's a responsibility that we have.
Yes. And I think, yes, I often think about our own well-being as
Mm,
practitioners, and
mm,
how sometimes it can feel quite heart-sink, can't it? It can feel quite
yeah,
demoralizing when we think, all I'm doing is pulling people out of the river. How could we stop
yeah,
them falling
yeah,
in it in the first place? So I think for our own well-being, it can
mm,
be important to think about,
yeah.
where
So
else can
true.
I have influence? Where else can I
Yeah,
be helpful?
yeah.
As well as, like
No,
you say,
you're
that
right.
strategic level.
So we can fall into a trap of thinking we've got to rescue people and make them better. And I don't mean to sound unsympathetic, I'm not. But it is hard working with people who haven't had support. And we can feel very protective towards them. We can feel very caring and recognize that they've not had the support they should have had.
Yeah.
But our job is sometimes also about people, supporting people next to them. We walk with them, but they have the answers and the knowledge. But as a clinician, absolutely, if we're not careful, we can feel responsible for all the wrongs that are out there in the world. And especially right now, we live in a time of such change, such uncertainty. And if we're not careful, we can feel, oh my gosh, how do I make all of this better? How do I take this terrible stuff away? And it's bigger than us. But
Yeah.
also knowing that I am enough, you are enough. We do tiny little moments with our service users, with our clients, but then also thinking about these wider themes as psychologist teams, as divisions in the BPS or in the HCPC. That's where our power sits, maybe at that voice that we have, that
Yeah.
we can meet together and think the psychological components that we that need to be implemented alongside developments or alongside change in the political sphere. I'm no politician, but I know that psychology and us as psychologists have a big role to play there.
Yes. Yeah. And you're reminding me of, the head of department where I was an assistant psychologist. And
Oh
I remember
wow,
her
okay.
saying to me how all you junior psychologists, all you think about is you just want to do therapy with people. As you as you
Yeah,
become more experienced, you'll realize that, you do therapy with one person, you've had an influence on one person.
yeah,
And, we could
yeah,
argue, couldn't we, that one person might influence, we might also be indirectly have an impact on their family, their significant people. But
yeah,
she's saying, yes, you get into policy, you get into service development,
yeah.
and that's where, and at the time I yeah, I wasn't ready to, I didn't quite
No,
understand what she
no,
was
but we,
getting
we want
at.
to do therapy. You're so
um
right, isn't it?
yes, yeah, and that's, yeah, it's important to be thinking on all those different levels, isn't it?
Yeah.
um
Um, I think it's also about us making sure people know about psychology in different settings, different roles, different contributions, because we can be seen as therapists, and yeah, many psychologists offer therapeutic input, but we do so much more. Excuse me.
yes.
And I think there's something about us holding the mirror up and showing to ourselves and to the world really where psychology can contribute. We've got such passion and such if we put all of the psychology divisions together, and yes, we might have had different trainings or different focus for our pathways, there's something that pulls us together, and that's the betterment of people. There's something about making sure that people can stand on their own 2 feet. We just support them along the way.
Yeah.
And different ways we do it. But if we can get that bigger answer out there, that bigger understanding rather than answer, sorry, of psychologists and their skills and their proficiencies, then maybe these conversations will happen more.
Yes.
They need to happen outside of the psychology space, don't they?
Yes. 100%. I'm aware of time. I want to ask you, I feel like we've covered a lot of the questions I often ask people through our conversation, but there are a couple of specific questions that I wanted to ask. And one would be, what advice would you give to students who think they might be interested in becoming psychologists?
I'd say, please come over to the dark side. It's no, I'd say that's lovely. We need you. I would suggest they look up on, for example, on LinkedIn or on the BPS website. Look up the different pathways that are there. Find out
Mm-hmm.
what a day in the life looks like for a person. On LinkedIn, you can connect with someone. You can send them a message and say, can you tell me about what it's like working as a forensic psychologist? Can you tell me what it's like to work as a health psychologist? And so on. And 9 times out of 10, people are so happy to help and share and explain. I would also suggest go on a work experience. We've got a person, I think the week after next, coming for work experience in the NHS.
Mm-hmm.
And they're going to be there for a week, but they're going to work with everything that we do. They're going to sit with a physio, they're going to sit with an OT, with the nurse, with psychologists. That exposure is very important because
Yeah.
psychology being taught at undergraduate level is vital, but it's very different from the psychology role that you might fulfill.
Mm.
And making those decisions of where do I go after my first degree, I would suggest have those conversations in your second year, in your first year as an undergraduate. Look at your local NHS trust or health board and be volunteering. Find out all the components so that you really make a considered decision. Because
Yeah.
psychology is massive, isn't it?
Yeah. Yeah.
And I'd say just ask questions. There's no such thing as a silly question. Come to the Careers Festival with the BPS. Ask questions because it's we need you absolutely. We need all the people we can get. But
Yeah.
there's so much variety out there, and I fear people sometimes only see one pathway or two, and maybe there are 20.
Yeah. Yeah.
So find out a little bit more.
I love that. Thank you. And I would want to add to it to not even wait till you're doing your degree,
Yeah,
but
you're right.
perhaps during sixth. I say this as a parent of teenagers who are considering their options, and I'm looking at the cost of university,
Yeah.
And thinking about, I don't know, even before you do a psychology degree, before you even commit to that, to have a sense of what you, as a parent, I'd want to say, yeah, have you got a sense of what you'd like to do with it?
Yeah, no, that sounds fair. You reminded me, there's a young person who's currently in her second year in Birmingham on psychology degree. And her dad and I used to work together when I worked in the West Midlands. And we have a chat from time to time, just thinking about her choices of next year's subjects or thinking about, okay, why am I interested in this and maybe not so much in that? And you're so right. The earlier, the better. It's big, though, isn't it? Big decisions. And sometimes
Yeah.
you think, oof, it's a lot, but dive in, ask questions.
Yeah.
Yeah.
And again, when we're thinking about how the world is and we're thinking about big picture, I say to my children, I went to university because it seemed fun and I didn't really know what I wanted to do. And that was okay because I'm old. There were no tuition fees. I'd love to be able to say to my kids to make that same choice, but
Yeah.
that just doesn't make sense these days.
No.
Which to me is a shame. It does
Yeah.
feel like we've kind of lost something. But then equally, maybe we gain something through making that more informed choice. And having more of a commitment to it, perhaps doing more of that research earlier on, and then hitting that degree with a I know why I'm doing this, I know what I want to get from it kind of attitude.
Absolutely. There's also something about psychology being one of the psychological professions. And sometimes people think, oh, I've got this picture and I must become this picture or nothing else. This might sound anathema, but I'm going to say it. People who work as psychotherapists, as music therapists, as counselors, psychological well-being practitioners, CBT therapists, they do vital jobs. And they have psychological knowledge at the core of what they do. And sometimes I see on LinkedIn lots of messages, people who feel, gosh, I must go this pathway because that's the only pathway that's going to ever work for me. And I would say, have another thing. Yes, there's that one pathway, but there are so many others. And people need different conversations with different types of professionals. Psychologists, we're one thing, but we're not all there is, So think a bit wider, even, thinking about locally to you, could you do a first course in a counseling diploma, perhaps? Or I work at the moment, I supervise someone who has worked as a counselor and qualified as a psychotherapist and is working as a psychotherapist and is now a trainee counseling psychologist. So there's different ways people find their career and what they contribute. So yes, psychology, I'd love to fly the flag, but we also one flag, so options.
I love that. And final question, I know that you have a blog where psychologists are sharing their story. It would be great if you're happy for me to put a link to it up with this video, great. But also if you could just tell us a bit about it.
Sure. It's a Pathways to Psychology blog. It's something that I realized there's less visibility of some of the pathways to train as a psychologist or as a psychotherapist, for example, as a practitioner. Then there's some pathways that we see a lot and we hear a lot, but others not so much. And that seemed a shame. So what I've done is I've pursued people on LinkedIn. I've asked them, would you mind telling me your story? Would you mind sharing? And it's just grown from there. I think we've got over 50 examples of people that are excellent, they dedicated, they're passionate people. And it's health psychology, forensic psychology, child psychology, educational, counseling psychology, health, all of that. And then we've got a couple of psychotherapists. I think we have a PWB, psychological well-being worker. And I invite trainees as well as qualified colleagues. And every person's story is different. It's wonderful, because we can just get so stuck and thinking, oh, I must do this, then I must do that. Sometimes life throws a curveball. And look at these people. They've had these curveballs, but where they are now, they're making such a fabulous contribution. So it's something I love doing, and I invite people, and I do know I send them messages on LinkedIn, but majority of people are so happy to contribute. And then it's great also for visibility for them and their website, or I've been contacted by students and people who are then thinking about pursuing a career, and they wouldn't have thought about that had they not seen the blog. So it's doing its job.
Amazing. I love that. Is there anything else you'd like to say, Lelanie? Is there anything I haven't asked you about that you'd like to add?
I'd invite anyone curious about clinical health psychology or psychology in general, link in with me. I'd love to chat to you, happy to answer questions, meet on Teams. It teaches me an awful lot, and I'd love to be part of your journey if I could help.
Oh, that's so nice. And what would be the best way for people to contact you? Is it through LinkedIn?
Yeah, I think LinkedIn is great. There's a message component on LinkedIn, and we can take it from there. Start a conversation. Happy to do it.
Wonderful. And I'm sure I'm sure that for some people, you might be encouraging them now. You might be their first kind of introduction to LinkedIn, and I've again, this is something I've talked about with my own children and with other students.
Mhm.
I think sometimes, and I can imagine, I mean, LinkedIn obviously wasn't around when I was
Mm.
studying, but I can imagine I might have felt like a bit of a fraud. You and I were talking about imposter syndrome before we
Oh,
started
yes.
recording,
Yeah.
but I think it's great, isn't it, to be following people, to be seeing what sort of things are people posting,
Yeah.
as well as messaging them
Yeah.
for direct conversations, you know, kind of
Yeah. It's
getting to
it's
see all the different
yeah.
things that people get up
It's a
to.
bit, it takes a bit of use getting used to. It's like any platform, but the amount of research that people share,
Mm,
the um, workshops, the learning, the reflection, the networks, it's fabulous. And not just for where you are in your area, you can see people over the waters, people in the US, people in Europe, people in Africa. And it's lovely also to connect with someone who's got the same passion as you.
yeah,
Maybe just have a message conversation and to see, what are you doing? What am I doing? How can we connect that somewhere? That's really lovely, because then you're not alone. You realize there's a community of people going in the same direction. That's fab.
yeah, awesome. I'm going to pause the recording there. Thank you so much for your time.
You're welcome. Thank you.
That's been amazing, and I'm sure people are going to find it really, really helpful.